Hello and welcome to the Practical Pediatric Medical Information Channel. Wow, that's a mouthful. I am MZMD. I'm a board-certified pediatrician. I am licensed in several states in the United States. I would like to emphasize that this video and all other videos on this channel are meant to be informational only and are not meant to be a substitute for diagnosis and treatment by your child's doctor. I hope that you will join me on these coming videos, and do not forget to like, share, and subscribe. Remember, subscribing does not mean that you're paying anything, but that's a way of notifying you when a new video has been uploaded to this channel. So let's proceed to the next topic. When your doctor tells you to use a certain medication or treatment, do a certain test, or take a vaccine, how do you know that his information is valid? Well, his information should be based on evidence, or what we call evidence-based medicine. It is not enough for someone to come up and say, well, I took this medicine and it worked and it did this or it did that. That's what we call a testimonial. That is not evidence. Evidence is based on studies or evaluations where bias, or what is called a placebo effect, is minimized. Again, testimonials may be true, but they are not considered valid evidence. First, let's discuss a placebo effect. A placebo effect means that there are a certain percentage of people for a specific problem that if they're given water for that problem or a non-medication for that problem, they will respond. That amount ranges from about 10 to 30%. And we have to account for that in any study we design or any study we plan. There are two main categories of studies: retrospective and prospective. Retrospective means that you take data that's already there and study that data and make conclusions based on the data that's already there. So for example, someone who's been taking a medication comes to the emergency room for a specific problem. In the future, someone comes, takes the chart, looks at it, and looks at what that person was on, and then make conclusions based on the material that's already present. These are okay studies, but they have drawbacks because you do not usually have all of the information about that patient when you look at that chart. Some things may not be written in there, some things may not have been asked. So the conclusions that you come to may not be valid. The more important study is what we call a prospective study. A prospective study is a study which is planned in advance. You have usually two arms in the study, which I will discuss what an arm means. And then you follow the people who are in those arms over a period of time, which is designated. Data is gathered over the period of study and then analyzed at the end of the study, and then conclusions are made at that point. There are some other terms that you need to be aware of, where certain things are done in that study to decrease bias. Let's pretend we are going to do a study, and we are going to study medicine A, to see if it actually helps with weight loss. So you take people and put them in one arm of the study, and those people are going to get medicine A. The second arm of the study, you're going to have an equal amount of people, and those people are going to have water, which looks like medicine A, but it's not medicine. To decrease bias, this study also has to be what we consider randomized. That means the people who are placed in each arm, the medicine A arm or the placebo arm, are done so randomly, so that the person who is doing the study cannot place what they think they want to place with the medicine, who they think should go with the placebo, because there is bias in even the investigators. So we do a random assignment of people in each study arm. There is also a term which is called blinded, which is also important to decrease bias. So the people who are in the study, the test subjects, so to speak, in both arms of the study, do not know what they're taking. So the people who are taking medicine A do not know that they're taking medicine A, and the people who are taking placebo do not know that they're taking placebo. So they have no idea if they're taking medicine A or placebo. Now, the best studies are double-blinded, which means the people within the arms, or the candidates or the test subjects, do not know what they're taking. Also, the people who are collecting the data, or the investigators, while they're collecting the results, they also do not know who took the placebo and who took medicine A. So in effect, it is double-blinded, and those are the best studies. Now let's get back to placebo effect, or placebos. The placebo arm of the study is to take care of that percentage of people that we know will respond to anything with a positive effect or a negative effect, depending on what you're looking at, and to take care of that percentage in the medicine A arm of the study. There's also studies that are called head-to-head, where you look at medicine A versus medicine B to see which medicine works the best. Those are very rarely done because drug manufacturers do not want to prove usually that their drug is better, because there's a chance that their drug may not be better. All they want to do is to prove that it's better than placebo. And if they can prove it's better than placebo, that it actually works, then they can leave it up to advertising to sell their drug. There are very few studies that have head-to-head studies. The drugs usually are compared to placebo, and drug A says, oh yes, it works great, to placebo, and drug B says it works great to placebo. But none of them want to take the chance that their drug may not be working as well as the other drug. So again, the best possible study, when you're looking at studies, now that you know some of these terms, you will be able to tell if something is a good study or not. It's a prospective study, which is randomized, is placebo-controlled, and it's double-blinded. Those are the best studies. And if you have studies like those that show that drug A works, then you can be pretty sure that drug A works. So after the data is collected, what happens then? You look at the data to determine if the effect of drug A actually is better than placebo. And the way you do this is through statistical tests, which are made up by statisticians, to see if there is a valid difference. So for example, let's take the study we were speaking about. We're trying to compare drug A to placebo. There are 100 candidates in the arm that is taking drug A, and there is 100 candidates in the arm that's taking the placebo. Let me go back a little bit. You want to have equal amounts of people in both arms, and the more people you have in an arm of a study, the more valid the data is. So if you have 5 people in drug A's arm and 5 people in the placebo arm, it's not as accurate as if you have 1,000 people in the arm with the drug and 1,000 people in the arm with the placebo. So let's say 100 just to round it off. So if you have 100 people taking drug A and 100 people taking the placebo, and 50 of them in the drug A arm have lost weight, and 45 taking the placebo have lost weight, how do we know that the difference of 5 actually shows that there is a benefit in taking drug A for weight loss? That's where the statistical testing is. And the statistical test will say whether a number of 5 in 100 people, the difference of 5 in 100 people actually shows an effect. And that's how we determine if drug A works better than placebo. This is what the FDA, the Food and Drug Administration, which is the administration or body that determines whether a drug can go to market or not. They look at this data, they look at the study in detail to determine if they can approve this drug to be used in the general population. So on average, a drug takes about 5 to 10 years from development to final approval to go to market, because these studies have to be done. They have to show that the drug works or is efficacious, and they also have to show that the drug is safe. So the FDA looks at the efficacy and the safety of the drug before they say we're putting our stamp of approval on this drug. Same thing with vaccinations. Vaccines have to usually take about 4 to 8 years to come to market from the start of development. So the FDA is critical in determining if a drug is safe and it's efficacious. And that's what they look at to determine if a drug or vaccine or treatment is actually showing evidence of efficacy, not just a testimonial, but is actually evidence-based. Which brings us to a side topic. There are certain things called natural medications or herbal remedies or holistic treatments. How do we know if these natural or herbal remedies work? Well, it's very important when you go to buy anything in the drugstore that you look to make sure it's FDA approved. Because if it's not FDA approved, no one has done those studies usually, because those studies take a long time and a lot of money to do. No one has usually done those studies to show that this drug is efficacious and is safe. They haven't done a prospective, double-blinded, randomized, placebo-controlled trial to prove that this thing works. So when you are using your herbal remedies, you be very careful, because most of these bypass the FDA. How do they bypass the FDA? Because they're not considered a true artificial drug. They were not created or manufactured in a lab. They were taken from the environment. So anyone can take a piece of a plant, grind it up, put it in a bottle, and put it on the shelf. Usually these were only sold in places like GNC in the past, but now, because it's a multi-billion-dollar industry, these are also present in Walgreens or CVS or your local pharmacy. So the most important thing that you need to make sure that you are going to have to be very cautious with using these natural remedies Doesn't mean that they don't work, but we don't know if they work. It doesn't mean that they're not safe, but we don't know if they're safe because they have bypassed the FDA because they're considered natural substances. Remember that natural is not synonymous with safe. And most of these products are sold in commercials and sold by testimonials, not by evidence-based medicine. Let me give you an example why evidence-based medicine is important. So presently we're going through the COVID pandemic. When this, what we call a novel virus, because it was never seen before, this particular strain of this virus, when we were first made aware of this infection or virus was around in early January or mid or late January, when we started to realize that there was this infection. Because this was a virus that was never present before, all of the information that we got was through testimonials. Basically, people saying in China or different parts of the world, I got the virus, this is what happened, we got information from governments. But no studies were done because there weren't enough people, and studies at that point were not done because this was new. So information given to the public was incorrect, not because the people given the information were stupid, but because they had very little information. And there were no studies to show whether the treatments or the information they were giving was going to work. So people were told initially nothing to worry about. They were told you don't need to wear a mask. They were told incorrectly certain things because the information and the studies were not done. Presently, it's about 9 months out, and we have more information. Many studies have been done, and we can say now, based on information or studies, that there are certain things we should do and should not do. Initially, information was given based on knowledge about other similar viruses, and this virus did not work or perform like those other viruses. So some of the information was not accurate and was not helpful. But now that we have more information, we are now able to attack this virus in a more robust way with information. So information is very important, and to prove things again, studies are important. So in conclusion, to prove that something works, you have to do studies. Someone giving a testimonial that I took this, or 10 people saying I took this and it worked for me, is not enough for evidence-based medicine. You have to have a proper study done. And the best study is a prospective, randomized, placebo-controlled, double-blinded study. I hope you can take this information and be able to understand better how decisions are made or how information is disseminated to patients by doctors. This should be based on evidence-based medicine. I hope to see you on the next video, because this video ties in with the next one. The next one is going to be on vaccinations and how do we know that vaccinations work, and if you should get vaccinated or your child should get vaccinated. This is MZMD signing out and wishing you a healthy life.